Hello, good day. It is me again, Dr. Ibe Nathans, your platform advisor. I am making this video now because I've heard a lot of concerns and questions regarding COVID-19 and being diagnosed in some patients without symptoms, in some patients with mild symptoms, and some people wanted me to talk about the symptoms that could just without symptoms, mild, moderate, and severe. And indeed, in my previous talks, in my previous videos, I had mentioned that COVID-19, coronavirus, can actually exist with or without symptoms. And I mentioned that the fact that people are out and about there does not mean that they are COVID negative or they don't have the disease. And that is the rationale behind our advice on isolating yourselves with your loved ones and the social distancing, washing your hands with soap and water regularly. Yes, indeed, somebody can have the COVID-19 coronavirus without symptoms. Somebody can have it in a mild form, in the form of the normal flu-like symptom, which is mild cough, feeling a bit unwell, mild temperature, aching all over, and it can equally manifest with other symptoms. When you have the severe symptom, which means the high temperature of 37.8 and above, or 100, where you have this constant dry cough. The dry cough is not like the usual cough. It is dry and constant that could last for half an hour, 1 hour or more. And obviously you feel tight in your chest and you cannot breathe. You know that something is wrong. You're very unwell. In that case, yes, you have to be admitted. The fact that, once again, somebody is out there walking, talking, looking well, does not mean that they don't have that. So those people that have been diagnosed with COVID-19 or coronavirus, either that they were diagnosed, they were tested because they've had contact with somebody with confirmed COVID-19 or coronavirus. If you have been diagnosed with coronavirus, we strongly advise you isolate yourself for 2 weeks. If you live by yourself, you have to be home alone, no contact with any person. If it's with your family members, you stay with them for 2 weeks, all of you. Nobody should go out, no contact with any person. So yes, let's recap. You can have the virus without symptoms. You can have it in a mild form. You can have it in a moderate form, in a severe form. And that is why we strongly advise, and we can't stop saying that, of maintaining the isolations, the social distancing for 2 meters or 6 feet, blowing your nose on a tissue, coughing on a tissue, sneezing on a tissue. Don't touch your eyes, don't touch your nose, don't touch your mouth. Making sure that you wash your hands regularly for 20 seconds, or singing happy birthday twice. If you don't have access to soap and water, making sure you sanitize your hands with a sanitizer. I hope this clears the concerns you have regarding the symptoms. I wouldn't stop this video like I mentioned. I wouldn't stop any talk without saying that prevention is the only treatment for this virus. Prevention is the only treatment for this virus. You have to protect yourselves, protect your loved ones, protect your family members, and protect those around you. Make sure that you adhere to the advice of your government, your healthcare provider, your doctor, your nurse, your clinician, by making sure you maintain the isolation and the social distancing at all times. And please, this brief video talk should in no way substitute your doctor, your nurse, or your government advice. Make sure you seek advice, you seek medical advice when necessary. Please make sure you seek medical advice from your doctor, your nurse, your healthcare provider, or whoever advises you on your health needs, who is trained to advise you adequately. And lastly, please make sure that your source of information comes from a government-approved website. Make sure your source of information comes from a government-approved website, your doctor or your nurse. Please be safe. Please play safe. Protect yourself. Protect your loved ones. Protect your family and those around you. God bless. Bye.